Okay, Bismillahirrahmanirrahim. Let's start today's lecture. Today's lecture is nanotechnology for cancer diagnosis and treatment. So first of all, we are going to discuss what is cancer. So cancer, as you all know, is an abnormal growth of cells that may occur anywhere in the body. So why this happens? This happens because genes start cell division at a much faster cell rate as compared to the traditional cell division rate. So this is why cancerous tumors may develop in various anywhere in the body. So cancer may be located at a specific parts of the body, or they may travel throughout the body. So as an example, I may quote the blood cancer. So in case of blood cancer, you see that the cancerous cells may travel throughout the body. And in case of the tumors, if the cancerous tumors develop, they may develop specifically at a specific point anywhere in the body, right? So the cancerous tumors may be site specific, may be location specific, and they might develop at a particular location. And the cancerous cells may also develop and they may also travel throughout the body. And the example is the blood cancer. Now, in case of the diagnosis of cancer, which strategies normally doctors or physicians use to diagnose the cancer? There are a number of strategies that could be utilized in order to diagnose the cancer. For example, physical examination. So your doctor or physicians may go towards the physical examination of the patients in order to diagnose the cancer. For example, they may examine the changes in skin color. The skin color may change in case of the cancer, in the case of the cancer patients, and they may also examine the lumps. So there might be the presence of lumps at specific locations in the body that those lumps may be physically examined. And then the doctors may also examine physically the organ enlargement process. So there are chances that certain organs might be enlarged and that may be linked towards the development of the cancer. Then there are a number of laboratory tests that are also used in order to specifically diagnose the cancer. For example, there are routine blood tests that may diagnose the cancer. And in case of blood examination, there might be an examination of the number and type of the white blood cells that is linked towards the development of blood cancer. So blood tests are the routine applications that are used in order to diagnose the cancers. Then the most widely used technologies or most widely used techniques that are used in order to diagnose the cancers are the imaging tests, and they are routinely used tests to diagnose the cancers. For example, CT scan. So you might be aware of the word CT scan. So CT means computerized topography scan. So computerized topography scans are routinely used in order to diagnose the cancers. Then there might be bone marrows that may be executed in order to diagnose the cancers. Then you might have listened the word MRI. So MRIs are also routinely used tests, imaging tests that are used in order to specifically diagnose or in order to specifically detect the cancerous tumors. So MRI stands for magnetic resonance imaging. So this is magnetic resonance imaging that could be used to diagnose the cancers. Then ultrasound imaging is also used to diagnose the cancerous tumors. X-rays are also used to diagnose the tumors. So these are the most routinely used imaging tests that might diagnose the cancers. Then another type of strategies that the physicians may apply in order to diagnose the cancer are the biopsies. So biopsy is actually the collection of specific cells in order to be examined under the microscope. So once we take the specific cells from a specific tissue, for microscopic examination, that means that is a biopsy. So biopsies are also used to diagnose the cancers from a specific tissues. And these cells, once they are collected from specific tissues, they are then observed under the microscopes for their shape, for their morphology, in order to compare them with the healthy cells. That doctors often examine that either the cells of the biopsy are the healthy cells or they are they are unhealthy cells. So their shape is not like the normal cells. So these are the routinely used strategies in order to diagnose the cancers. Then there are certain challenges associated with the cancer diagnosis. And these challenges are directly linked towards the treatment of cancer. So as early and as efficiently the cancer is diagnosed, more effectively it could be treated. So this is a common sentence that could be linked to the treatment and diagnosis of the cancers. So the challenges that are associated with the diagnosis of the cancers are all linked towards how efficiently and how early the cancer could be diagnosed. So often, currently, what is happening that often the cancer is diagnosed after a significant changes in the cells have had happened. So because the cancers are the uncontrolled growth of the cells, so when there are significant changes in the cells have already been happened, then we diagnose then we will be able to diagnose the cancers. And in most of the cases in cancer patients, the late diagnosis is the routine test. So uh, this is a great challenge that if we are able to diagnose the cancerous cells or the cancerous tumors more earlier stages, the more effectively cancers could be treated. So early diagnosis is a challenge. Then detecting cancer even from a single cell is very important. This is also a challenge. If we would be able to detect the cancers from a single cells, then there would be very effective treatment strategies would be applied in order to treat the cancers. So this would be very effective if we would be able to diagnose the cancers from the single cells rather than diagnosing once they have developed so many cancerous cells in the form of a tumor. So, uh, so early diagnosis and diagnosis from a very early changes in the cells is very important in case of the treatment uh, of the cancers. Then, in order to cope with these challenges that are associated with the diagnosis of the cancers, nanotechnology uh, may give some tools, may give some strategies in order to formulate new diagnostic tools and also in order to improve the currently available diagnostic strategies. And now we are going to discuss one by one how nanotechnology could help in this area of the diagnosis of the cancers and how new diagnostic strategies could effectively be formulated by using the nanomaterials and how currently available nanotechnology, how currently available diagnostic strategies could be improved by using the nanomaterials. So number one, nanoprobes in order to detect the cancer-related genes. So as we had already discussed in yesterday's lecture, that probes are those materials that specifically bind to those genes that are related to the disease. So in case of the cardiovascular disease, we had discussed yesterday that then nanoprobes could specifically bind to those genes that are associated with the cardiovascular diseases. And in the similar fashion, we can also use these nanoprobes in order to detect those genes that are related to the cancer. So cancer-related genes could be detected by using these nanoprobes that bind to those cancer-related genes. So this means that if we use nanoprobes, the cancer could be diagnosed, the cancer could be detected at much more earlier stages as compared to what we are diagnosing diagnosing nowadays in conventional techniques. So as early as the cancer is diagnosed by using these nanomaterials, more effective treatment strategies could be formulated, right? So this is number one. Then number two, nanosensors to detect the cancer tumors. So once the tumors have been developed, once the tumors have been formed, then nanosensors could be utilized in order to more specifically, in order to more efficiently detect or diagnose these tumors as compared to the traditional methods. So how these nanosensors could be more advantageous, how these nanosensors could be more effective as compared to the traditional strategies, the, this we are going to discuss. Now, these nanosensors have an advantage that they would specifically bind to only those cells that are responsible for the development of the tumors. So one, one advantage, another advantage of these nanosensors is that these could be, because these are at nanometer scale and they are very sensitive, they are very tiny in size, so they could be administered, they could be utilized in those organs or in those areas where the tumor detection is very complicated or very difficult in case of the traditional methods. So in this way, nanosensors could detect only the small tumors and the tumors that have been developed in those areas where, uh, where the normal detection methods could fail. Then another nanomaterial based strategy that could be applied in order to diagnose the cancer is, is the nanomaterials to enhance the imaging quality. So as we have already discussed in the previous slide, that a number of imaging strategies, a number of imaging techniques are utilized in order to diagnose the cancer, for example, CT scan, for example, X-rays, ultrasounds, for example, MRI, and so many other imaging techniques, because we are going to image the tumors that have been developed with the cancerous cells. So existing imaging strategies or existing imaging technologies to diagnose the cancers could be, the quality of these strategies could be enhanced by using the nanomaterials. The question is how? How nanomaterials could help to enhance the quality of existing imaging techniques in order to diagnose the cancers. The reason is nanomaterials, they are very sensitive. They have a much smaller size and they have a very unique optical property. Now, these optical properties could be utilized in the imaging technique. These unique optical properties would enhance the imaging quality of the existing strategies in order to detect the cancerous tumors. So optical properties are one advantage that nanomaterials has over over their corresponding macromaterials that would ultimately contribute towards enhancing the imaging quality of the existing diagnostic tools of cancerous tumors. Then we are coming towards the treatment of the cancers. Now, there, as we have already discussed, that there are some issues that are associated with the diagnosis of the cancer. Similarly, there are some issues that are associated with the treatment of the cancers as well. So now we are, first we will discuss about what are those challenges that are associated with the treatment of the cancers, and then we will move towards how nanomaterials could effectively be used in order to cope these challenges. So what are the challenges that are associated with the treatment of the cancers? So challenges are the non-specificity of the currently available therapeutic strategies. Non-specificity means that the currently available therapeutic strategies in case of the treatment of the cancer are not able to specifically kill only the cancerous cells. Unfortunately, the strategies that are currently available, they, although they kill the cancerous tumors, they can kill the chemotherapy agents or the radiations that we mostly use. They can kill the cancerous tumors, but at the same time, there are chances that they also kill the normal healthy cells. Now, you might have seen some patients that are on chemotherapy, that are on routine chemotherapy. And if you see those patients, you might have observed that they become weak in a shorter in a shorter span of time. So reason is because they are taking the chemotherapeutic drugs. So those drugs are, they are killing the cancerous cells, and at the same time they are also killing the normal healthy cells. So patient becomes weak, and there are so many other side effects are also associated with using these chemotherapeutic drugs. So this means that there are huge challenges that are linked to the currently available therapeutic strategies in case of the treatment of cancer. So these challenges are non-specificity of the chemotherapy. So the chemicals, the therapeutic drugs that we are nowadays that are currently available, they are non-specific. They are beneficial, of course, but at the same time, they also have a huge number of side effects, and they also kill the healthy cells in addition to the cancerous cells. And at the same time, non-specificity of the radiation therapy. So radiations that we use in order to kill the cancer tumors, they are also non-specific. They would not distinguish between the normal healthy cell and the cancer cells. So once they are not able to, they are not able to, distinguish between the healthy and cancer cells, it means that they are going to kill the cancer cells and along with the healthy cells as well. Then, in order to cope these challenges that are associated with the treatment of the cancers, nanotechnology or the nanomaterials could play their role. So there are some strategies that are in research trials and that might be available in the near future, and that becomes more effective as compared to currently available traditional therapeutic strategies. So now we one by one going to discuss what are those strategies that could be linked, what are those nanomaterial based strategies that are linked to the treatment of the cancers. So number one is the use of nanoshells. So we can use nanoscale shells that are at nanometer scale in order to treat the cancers. So as the name indicates that the shells are those materials that are hollow from inside. So when the shells are hollow from inside and they are at a scale of a nanometer, then this means that we can stuff drugs inside them. So once we are able to stuff drugs inside them, we can then very specifically, we can then in a very controlled fashion, release those drugs to the cancer tumors. So what we can do is these nanoshells could be used, they could be coated with gold nanoparticles in order to heat these gold nanoparticles with infrared radiation. So one strategy is the use of nanoshells and then heating these nanoshells with the infrared radiations in order to heat them and to use them as therapeutic agents. So what is the what would be the benefit? Benefit would be that these nanoshells, once these are heated, once the gold nanoparticles associated with these shells would be heated, they would in a very targeted fashion kill only the cancerous cells. They would kill only the cancer tumors, and they would not be harmful to the normal healthy cells. So this is advantage. Another strategy of using these nanoshells is that nanoshells could be attached with antibodies. So you know that we can use antibodies in order to treat many diseases. And currently, in case of the COVID-19, you are well aware of the fact that people are using the antibodies of the other patients that have been recovered from the coronavirus, and they are injecting the antibodies from the foreign sources in order to immunize them, in order to develop the immunity in their bodies against the coronavirus. This is a common strategy to use the antibodies in order to treat the diseases. So what we can do is we can use these nanoshells and we can attach the antibodies with these nanoshells, and then these nanoshells would very specifically and in a very controlled fashion, they would release the antibodies only to the targeted sites. And ultimately, the cancer tumors could be treated by releasing these antibodies to the targeted sites. So this is one advantage. And another advantage is that once these nanoshells would release these antibodies to the targeted sites, and in a very controlled fashion, the immune system that could be activated against the antibodies could be kept unaware. So this is a routine practice, and you are aware of the fact that once the foreign body attacked the human cells, the very first reaction that comes from the cells is the activation of their immune system. So when immune system is activated against the foreign bodies, then this is the common mechanism of the fighting against the foreign bodies. So these foreign bodies, which are being administered to the nanoshells, they could be treated as the foreign bodies, and immune system can be activated against these antibodies. So whenever they are used, they are administered through these nanoshells, the immune system could be kept unaware about these antibodies by releasing these antibodies in a very controlled and in a very site-directed manner. Then another strategy of using nanoshells in order to treat the cancer tumors is the use of nanoshells. Nanoshells could also be filled by drugs containing polymers for specific release of these polymers onto the targeted sites. So this is another strategy of using the nanoshells, that nanoshells could be attached with gold nanoparticles, nanoshells could be attached with antibodies, and nanoshells could also be at the same time stuffed with certain drugs, so that these drugs could be released on a very specific areas, on a very targeted sites inside the body, so that the cancer tumors could be treated in a very specific and targeted manner. So this is how nanoshells could be employed in order to treat the cancer tumors. Then number 2, nanodendrimers. So nanodendrimers could also be employed in order to treat the cancer tumors. How? So if you look at this picture here, you see that this is the common shape of a dendrimer. So once these dendrimers are shaped at a nanometer scale, they are called as nanodendrimers. So these dendrimers could be stuffed with multiple drugs. So this is the shape of the dendrimer. So many drugs could be stuffed in these dendrimers. For example, one drug could be stuffed here, another drug could be stuffed here, and if you have another drug, that could be stuffed here. So multiple drugs could be delivered by using these nanodendrimers in a very specific and in a very controlled fashion to the cancer tumors. So the advantage of using these nanodendrimers, or advantage of using this technology, is that the multiple therapeutic agents could be delivered to the targeted sites at one particular time. So this means that a cumulative therapeutic impact of many drugs could be achieved. And this means that we can have a much more efficient result of many drugs in order to treat the cancers by using these nanodendrimers. Then another, number 3, another strategy of another nanomaterial based strategy to treat the cancer cells is the use of gold nanoparticles. So gold nanoparticles could be used specifically in case of mouth cancers. So mouth cancer, you know, is a common cancer, and the reason, uh, the most common reason of the mouth cancer is smoking. So gold nanoparticle will be used as treatment strategy in case of the mouth cancer. And how they would work that these gold nanoparticles could be heated by using the laser. So because gold nanoparticles could be easily heated because of the metallic properties, so they could be heated by using the laser. So once these gold nanoparticles are applied to the tumors in case of the mouth cancers, so once they are applied, they could be heated on targeted site. They could be superheated, and once they are superheated, they could kill all the cancerous tumors in case of the mouth cancers. So what is the advantage? Advantage would be that as compared to the traditional strategies, these gold nanoparticles would be heated on a very specific site, and they would ultimately kill only the cancerous related cells. They would ultimately kill only the cancer related tissues as compared to the traditional strategy. So the healthier cells could be saved from the effect of these gold nanoparticles. Then the last strategy that I'm going to discuss today for the treatment of the cancer by using the nanomaterials is the use of magnetic nanoparticles. So yesterday we had already discussed about the magnetic nanoparticles. Uh, so if you see the picture here, you see that the magnetic nanoparticles are those nanoparticles that have a magnetic core. So their core is of have a magnetic properties. For example, the iron nanoparticles and cobalt nanoparticles, nickel nanoparticles, they are the magnetic nanoparticles. But and at the same time, they have a interfacial layer that could have an attachment of many functional groups responsible for their functionality. So magnetic nanoparticles could be employed in case of cancer to specifically treat only the cancerous tumors in a very targeted manner. And mostly these magnetic nanoparticles are utilized in case of breast cancer. So breast cancer is a common type of cancer that exists in females. So in case of breast cancer, these magnetic nanoparticles could be very specifically applied to the malignant cells only. So they would, what they would do, what they would, they are going to do is they would specifically, due to their magnetic properties, they would specifically attach to the surfaces of the cancerous tumors. So they would attach to the cells, or they would attach to the surfaces of the cancerous cells. So once they are attached, then they could be heated by laser, by using the laser, and they could be superheated. And due to this site-specific superheating, they would only kill in a specific area the cancerous tumors, and they would save the remaining healthy cells. In this way, uh, this strategy could be applied in order to treat the breast cancer. So thank you so much for today's lecture. This is all about today's lecture about the nanotechnology and its use in case of diagnosis as well as the treatment of cancer. Thank you very much. If you have any question, you can ask.